Let me first start at the beginning. We have a test running in the university hospital, which is in fact designed for prenatal testing to detect fetal DNA in the circulation of pregnant mothers and to look for fetal chromosomal abnormalities. While using this test some 3 years ago, we found out that some fetuses were normal, but the test was abnormal, and it turned out that the mothers were having cancer. So there was nothing wrong with the baby, but the mother had cancer. So this showed that this test that we had, that it was able to pre-symptomatically detect cancer. So that's what happened before the study started. So we then started a large study in 1,000 elderly, healthy people who did not have cancer, but just because of their higher age had an enhanced risk of developing cancer. So we took a blood sample, isolated cell-free DNA, subjected this to this prenatal test, which we do not call NIPT anymore, but we call it a GIP sequence for genome-wide imbalance profiling. And then we were looking into the cell-free DNA to look for chromosomal abnormalities that could be predictive of the presence of a malignancy. So in fact, of these 1,000 people, we found that 30 elderly people had chromosomal abnormalities in their blood, circulating cell-free DNA, and 6 of them had cancer. 24 others had detectable copy number alterations in cell-free DNA, but no cancer diagnosis could be made within the time frame of our study. So the question now remains, where does this aberrant cell-free DNA come from? What is the biological importance? Will it eventually become clinically relevant over time?
And then these patients with the positive results but no cancer detected, are they followed up for screening and counselling in the event that any cancer does arise?
Well, yeah, in fact now we ask for other grants to support this type of research. We are planning a long-term follow-up of these people who had detectable copy number alterations, not only to see how these copy number alterations evolve over time, whether these patients develop cancer, but we also want to have another look at the cell-free DNA, look at the methylation profile to see from which tissue the DNA is coming from, to get more biological insight into these copy number alterations observed in the bloodstream.
Can I just double check the methodology? You mentioned the chips, what's the sensitivity for the screening and the throughput?
With regard to the sensitivity, yes, we have 5 people being positive for these copy number alterations. So far we don't know whether other people with a normal profile also have copy number alterations, so long-term follow-up will have to answer this question.
What's the timeline for expansion and follow-up through the rest of these studies?
Well, that's a good question. We are now hoping to start a new follow-up study, which is about 3 to 5 years after the first inclusion of these patients. Of course, this is maybe not long enough to see how they will evolve in the long run, so maybe afterwards another study can follow. But if these results would be positive, then this would open perspectives for clinical studies on a larger scale, for instance on a European scale.